Hi, everyone. I'm Steve. I'm here with Dr. Nario. Thanks for being here, Doc.
Hi, Steve. Thank you for having me again. Always a pleasure.
All right, so Dr. Nario is at Biointegrative Health Center in Reno, Nevada. You can check him out online and see all the different cool treatments that they do if you're interested. All right, and if you're interested in our weight loss program, use the QR code on the screen or hit the link in the description. If you're interested in interviews with doctors, nutritionists, personal trainers in our gyms, subscribe to the channel. All right, so we're going to talk about mushrooms. Now, there's a lot of um, health aspects or a lot of benefits of different mushrooms. And you're going to tell us three different mushrooms and what's the benefit. So first tell us, well, how about the first mushroom that you have in mind?
Well, Steve, there's really a lot of, I guess, I want to make sure our audience understands that there's a recreational mushroom, the fun party type of mushroom, versus the medical type of mushroom, right? So when I talk about the medical mushrooms, this is the one that I use on patients. I guide them through it when they want to address health issues for it. And to differentiate again, the party mushroom is psilocybin. It's not party mushroom. It's really more of hallucinogen, but we always kind of affiliate that with the groupies or the ones who uses it in ceremonies. And the ones that I would probably focus on today would be the top three that I encounter in my clinical
Okay,
practice.
wait a minute. Now you have me curious.
What?
What's the party mushroom do?
So the party mushroom is actually it's not really a party mushroom. It's really more for it's hallucinogenic. It's almost like that's why it's next to the ecstasy
Like a drug?
or right.
I
So
mean, yeah, I've heard of it, but I never
yeah,
used mushrooms. I'm just curious what they make you dizzy or drunk or what? High?
they make you jump on the top of your car and you're going to be in the news the next day for sure. But no, this is this is called psilocybin. So this is something that you will hear a lot, and this will be used in it's usually illegal here in the U.S., but in other countries, it's actually a therapeutic modality. And where do they use it? Like with patients with PTSD, for example, anxiety, depression. So it gives you that psychedelic therapy that makes you go back to these moments to make it easier for you to cushion the blow. So it's really more of a psychological effect. But the problem there is the government's pretty tight on this just because again, there's so much psychedelic effects. And currently it's being on studies right now and research studies trying to see if there is really a place for it in the Western medical field. But that's basically psilocybin, and this is one that you will hear done in ceremonies with shamans, for example, and you have organized groups that does this for therapeutic approaches. So it's different from the supplemental mushrooms that I'm going to be talking about.
It's amazing that a mushroom can do all that.
Yeah, I mean, there's so many different types out there, so just be careful what you pick in the forest when you're camping.
Okay, I will. All right, so what's the number one positive? First one, not in any necessary in any order, but what's the
Right.
first one?
So the first, well, really the most common one because I actually address mental health or the memory, lion's mane. So I don't know if that's something that you've heard of before, but this is actually it, and it's known for enhancement of cognitive functions and mood. And this is the Asian countries kind of started this trend when the lion's mane was discovered. And when if you see this mushroom, it actually looks like the hair of the lion around their heads. And the thing there is Alzheimer's actually had started using this in terms of studies. The study actually has been shown that mild Alzheimer's found taking 1 gram of lion's mane mushroom daily for 49 weeks improved cognitive test scores compared to the ones who are not taking it. So that's actually because majority of these mushrooms, most of the studies are animal. But for lion's mane, there is now a study that could actually back that up. And also, there would be, of course, help with anxiety and depression. So you would notice it's working on our brain and in the brain a lot to actually regulate these neurotransmitters that we have. And of course, on the side, we also have its anti-inflammatory effects, antioxidant properties that helps with heart and also digestive issues. So that's my number one in terms of I have a lot of brain patients or patients who wants to improve their brain function, and I use that.
Lion's mane. So you do use that a lot with your patients.
That's right.
Just a capsule? Is that how they take it or?
Well, yeah, lion's mane can be majority of what I use is in capsule form, but you could definitely, I think you can see this also as a food. Correct me if I'm wrong. I'm not sure about that, but I always use capsules on this, and also powder.
Yeah, that's what I thought.
Hmm.
Okay, so what's the second one?
The second one is because of our cancer background, meaning we handle cancer patients also. It's actually reishi mushroom. So reishi is known for its immune boosting effects in terms of actually enhancing the cancer fighting cells to actually kill or promote the killing of cancer. And of course, infections that goes along with it as well. And the thing here is it's actually been seen to have effects on breasts, prostate, colon, and even colorectal cancer. And that's why you would notice that in integrative practices, there's a lot of reishis introduced in their regimens to take. But also on the side, there also is heart, blood sugar management, and even strength and stamina. So you get extra umph with reishi, but it's really known more in the world of oncology.
Yeah, mushrooms are really popular for just as a supplement for different, you know, ailments or to protect from certain things. I know they're really popular. People put it in
Right.
their coffee, so
Well, later on, we'll talk about, as you could hear, that, I mean, even commercially, that mushrooms are safe for everybody, but we're going to talk about that later. There are some do's and don'ts that we have to understand and know.
yeah, I mean, it's a food. You'd think that some people might be allergic to it. I don't
Yeah.
know. But so how do they take Reishi mushrooms? Or that's a powder, or what's the different way?
Same powder and capsules. That's well, lion's mane for sure. I now have confirmed that, and I remember that can be taken as a food, but I don't know about reishi though. So reishi, I'm always giving that in a form of capsule and also powder.
That's how you give it.
Yep.
Yeah. Okay. What's number three?
Number three would be turkey tail. So turkey tail is also something that helps with. So why I like turkey tail? I'm sure you've seen turkey. It looks like the back of a turkey, right? The tail of it. It also helps boost the immune system. So these are for the ones who get sick a lot, or somebody who has like an illness now and wants to address that flu or bug. So that's something that I use on them, the turkey tail mushroom, because it has a lot of antioxidant effects as well. The good thing I like about turkey tail is it enhances the gut for the reason that it's a prebiotic. This is something that your good bacteria or good guys like, and when they eat it, they actually get a little bit more energized with it, and now produces all these healthy metabolites and even reduces the symptoms of leaky gut. And special one is turkey tail extract can help protect against, so this is for women, HPV infection. So that's something that would prevent that, cervical cancer. You always hear about that, pap smears in the vaccine. This one is something that actually helps in relation to that prevention. So, and as being a mushroom, it has all these antibacterial, also antioxidant and immune regulatory effects.
So that one's for the immune system. Someone has a cold or something.
Right, that's right.
It's amazing how many different mushrooms are out there and how many
Uh,
different positive uses that people use them for.
right, right. And here's maybe a bonus for everyone. Cordyceps. So that's I only one we're talking about three, but this is one of my favorites too, because I use cordyceps a lot for stress. It's one of the more famous adaptogenic herbs that actually supports the body to adapt to physical and mental stress, balancing cortisol levels. And some extra stuff for cordyceps would be athletic performance. So it's our audience out there in the athletic world. It increases ATP production and in relation to the mitochondria. So that's something you really want to put in your regimen as well. And also I use a lot of this for kidney problems. So anybody who has lowering or decreasing kidney function, it protects against kidney disease. And also some extra stuff, sexual health. So this is something to improve the sexual libido, performance, and reproductive function. And who doesn't want that, right?
Yeah. Well, yeah, cordyceps is a very popular mushroom. So you mentioned something about putting it in your coffee because I know people do that.
Huh?
Can you do that? I mean, is it effective? You were kind of, let me tell you about that. So I want to hear about that.
Yeah, so as I mentioned to you, there's so many different ways on how we can put mushrooms into our system. And the most common ones out there, capsules and tablets. But there are powder forms, and you're correct. You can definitely do that. It's going to be made in in coffee, tea, or even smoothies, or you can even drizzle it in food. So, but just make sure though you get a product that is actually built for that, because there are some mushrooms that products that are don't expose you to extreme heat because it will get destroyed. So really depending on the product that you actually would pick. But I think majority of them are capable of doing that. And also it would be promoted in using it in tea form or even liquid extracts and even tinctures. And they're now sprays and gummies, but this is not the more common versions of when where people get it nowadays. I always am a big promoter, as I told you, of real food. That's why whole cooked mushrooms are the best ones that I could actually advise for everybody because you could mix it up with other vegetables and you're eating other nutrients like another protein that goes along with it. And majority of them would be in the food world. Shiitake, maitake, and lion's mane are common as part of your cooked meals.
Yeah, it says it right on there. And you can get organic too.
But yes, of course, we always like organic for
Yeah,
sure.
you can. Yeah, I cook with mushrooms a lot. I saute them, put them on a healthy hamburger.
Yep, yeah, that's right. Even the button mushrooms, those are, even though I didn't mention that, those are actually good immune stimulators.
That's a big, big bun mushroom.
Big, right? Sure, we can definitely put that in there.
Right. So, what else do we need to know about? Is there anything we need to know about mushrooms in general or any of these specifically?
Yeah. So I think you mentioned this before the we started the recording that are mushrooms healthy for everyone? Can everybody take it? So there are, in general, they are pretty safe, but of course there are some must knows that there are situations that you just need to be careful. For example, an autoimmune disease such as lupus, Crohn's, especially if you're in a flare, because as we know, it's an immune stimulator. So these are autoimmune diseases already that are on fire when it's in the flare. So that's why when you add more mushrooms in there, it can aggravate the whole autoimmune response. So that's why, again, I always want to say to patients that have a medical provider guide you through this. Sometimes it might be detrimental for you when you use it that way. Cancer patients, for example, cancer patients who are not going through there's a treatment called immunotherapy. So it enhances the immune system to kill cancer. If you take it along with that, now you can actually have more side effects from that therapy. So it can aggravate the whole situation. And then also, when you're talking about people who are post transplant, so they're on immunosuppressive drugs. So definitely don't add more immune stimulation to those situations. And we always hear about pregnancy and breastfeeding, always a no no for any herbs. So definitely don't people actually has this experience that it can aggravate bleeding problems. So it's almost like fish oil, right? And when before surgery, you should avoid this and not take it beforehand because it has blood thinning effects. So people who are taking blood thinners, be cautious about especially reishi, who can aggravate bleeding issues. And of course, the common ones that you just mentioned, allergies. If you're known to be allergic to a mushroom, avoid them at all costs. And some little things like low blood pressure, liver conditions, and diabetes can be aggravated. But as I said, it's not like a vitamin C or multivitamin that you can take. Make sure you check all your boxes the right way.
Yeah, you said a couple of things there. First, mushrooms are an herb, okay, and some people can't use herbs, or
That's right. Not
at
all.
certain times they shouldn't. Like, why when breastfeeding?
So breastfeeding is just something that we're worried about transferring it to the breast milk. So let's say if your child is immunocompromised, so let's say it's a premature child, right? So the immune system is not in the best of shape yet, or if a child has some autoimmune condition that we don't know about. So that's also something that we're going to be worried about in terms of transference. So that's why just again, in general, it's safe, but these are things that our audience that just needs to know that they should probably ask their medical provider about for guidance.
Yeah, it makes sense that some people would have allergies or
Hmm.
be allergic to certain mushrooms because it's like some people can be allergic to anything, right?
Right, that's correct.
All right. Well, any last thoughts?
Yeah, so as I let me insert a common question that I always get about mushrooms.
Okay.
So I always get, can mushrooms affect candida in the gut because it's like a mushroom, right? It's a fungus. Now you have yeast in the gut. Is that a problem? Actually, the answer to that is medical mushrooms, such as turkey tail, shiitake, and reishi, have demonstrated antifungal properties that may help combat candida overgrowth in the gut and support the immune function. So that stereotype or that myth that don't take mushrooms because you have candida, it actually will help against your candida infection.
Interesting. Opposite of what people think.
That's right. So let's debunk that myth right there.
All right. Well, that is great stuff. Good information. Thanks for your help. Thanks for your input. And we'll talk to you next time.
All right. Thank you, Steve, for having me again. As we all know that our knowledge is your power to better health. And thank you for letting me provide you with longevity in health maintenance, which I call the biological edge or the bio edge.